Hello, everyone, and welcome to today's Power Up Nursing webinar, Independence, the Future of Continuing Nursing Education. And I'm your host, Dr. Kimberly Delbo, and I'm thrilled that you're joining us today for this exciting conversation about innovation, independence, empowerment, autonomy, and the future of lifelong learning in nursing. If you're like most nurses, continuing education can sometimes feel like just another checkbox that we have to check. One more requirement to meet an already demanding schedule. But what if continuing education could actually work for you, adapt to your needs, and honor the real world ways that you already learn every single day? That's exactly what today's guests have set out to do. I'm joined today by Karen DeMarco and Wendy Harold, the visionary forces behind RNegade, already known for shaking up the CE space with their innovative podcast platform. And today, they're here to introduce you to the newest breakthrough, independence. Karen and Wendy, welcome to today's webinar. I know our audience is so eager to hear about what you're building, and I just want to dive right in. So, Karen,
Oh my gosh,
RN
Kimberly, did you go
Renegade
to like
has
journalism school?
Stop.
I feel like I'm watching
Too
like a news
much.
show, don't you,
You're
Wendy?
way
She's
too
so good
much.
at that.
I know. She knows stuff.
She does.
No.
Mhm. Thank you. We're thrilled to be here.
Yeah.
Maybe a little bit, it's so great to have you both. Thank you for joining us. We're honored that you'd be able to be here, and we're grateful for your partnership with Power Up Nursing and our work together over the last several months. But Karen, RN Renegade, I just want to talk to you a little bit about what that is, because some people out there might not even know about what Renegade does. But talk a little bit about how that launched into this new thing that you're calling IndependenCE.
Got to do the wind up. So it's short. Renegade came about, the
Sure.
idea was inspired by my nursing license being up for renewal. And like most nurses, at least most that I've talked to, 90% of us, that is not an official stat, at least that's definitely what it feels like. We all drag ourselves across the finish line to get those 30 CEs every 2 years to renew our nursing license. So mine was up for renewal. I ordered 4. I wanted to treat myself this time, Kim. I got 4 6-hour lectures about psychoneuroimmunology, how it affects the cardiac system, like different, and that's kind of my wheelhouse. That's where I've published research before. And I was just going to enjoy them this time. But they came on CD, copyrighted, locked CD. Even though I went to go get an external CD player that I hadn't had since the 80s when I had my Discman. I had to go buy one, and I'm thinking, okay, at least I can upload them to my computer, download them to my phone, and go about my business while I'm listening to these 24 hours of lecture material.
Yeah.
Couldn't do that because it was locked, and it just all came to some expletives were uttered, and it was like, this is just like and the thing that really bothered me, that hit me when I went on a hike after I realized I couldn't upload and download the course material into my phone. I went on a hike listening to a Joe Rogan podcast, and it hit me. He was interviewing James Nestor, who wrote a book called Breathe, and I'm in the middle, on the top of the mountain, ordering the book off Amazon because it was anatomy physiology review. It was theology. It was the history of tribes and how their health was impacted by their symmetrical faces and their wide palates and all this stuff. And it was all delivered through the Trojan horse of James Nestor's personal story and how having his palate expanded totally changed his health and whatever. And I was just, oh my gosh, I'm learning all the time. I am doing, because I have skin growing on my AirPods because I'm always got a YouTube video or a podcast or something in my ears that is making me not only better at my job as a nurse and my one-to-one practice, but it's also improving my life. And for some reason, this hadn't occurred to me before. I'm doing 30 continuing education hours every 2 weeks at least, and I'm not getting credit for it. And that's stupid. So fast forward, I got my providership, my continuing education providership through the California State Board of Registered Nursing. That's good in all 50 states except for Hawaii. I think it's still not good in Hawaii. I have to check on Hawaii. Hawaii's kind of come around in some things in the last couple of years. But we started Proof of Concept CE by podcast. It wasn't the original idea, because the original idea, which we'll get into when we talk about independence, and CE on the end of independence is capitalized. See what we did there?
I love that. I love that. So creative.
I was thinking not just about the podcasts and the YouTube videos and the audiobooks and all those things that I listen to that I should be getting credit for, but I was also thinking of all the conversations that I have with the collegial conversations at the nurses station, at Mimosa Monday after a hard night shift in an ER. You go and you do case study reviews and what went wrong, what went right, and the research shows. I've got two behind my screen on, behind your beautiful faces on my computer. I have two research articles up because I always referred to them, that say that nurses learn best from other nurses, that mentorship, that whatever. And why aren't we getting credit for those kinds of conversations if the research shows that that is how we learn and retain best? So RNegade was CE by podcast. First, we did our own. We interviewed experts. We enjoyed the time. It's like, between Wendy and I, it's like George and Gracie and Lucy and Desi, so we keep them entertaining. It's not just a PowerPoint head up in the corner when you're going through slides, so you can just check a box. And it worked. And then we started inviting other podcasters, other really popular health and wellness podcasters on, and started creating an academic syllabus for the qualifying podcasts of other people. And nurses can come on RNegade and listen to podcasts and earn continuing education. But independence is the pure form of the original idea, because anything we do, the self-directed, self-paced learning that we do naturally, that doesn't require us, forgive me, because I know not all education is boring and outdated and antiquated. I don't mean to paint with a broad stroke, but a lot of it is going and picking through a pile of crap every 2 years because you just want to check the box and get it done. Because the good stuff is at conferences, but it's like expensive to leave your family, and it's difficult, and so much rich potential for learning is right at our desk. It's on a walk with a colleague. It's in the hospital. It's curbside consults. That's where the richest learning occurs, and we don't get credit for it. Well, the ANCC is a great example of learner-directed, learner-paced education. It's their third tier that most nurses don't even know about, and they certainly don't utilize, because it's a pain in the butt. You have to identify your gaps in knowledge. It's a whole process, and it's a lot of narrative. You identify your gap in knowledge, you identify the sources that you're going to fill the gap with, then you have to do a narrative of there's a whole process to it, but it's possible. It is widely accepted. It's the third tier of learning. There's instructor-directed, instructor-paced. This is live, conferences, academic settings, workshops, anything live. There's instructor-directed, learner-paced. That's all the recordings. Most of our RNegade stuff is instructor-directed, learner-paced, because we're the people who are determining what's on the podcast or which podcast we pick that qualifies continuing learning education. But this learner-directed, learner-paced is the most natural way we learn, and we're doing it all the time and don't even recognize it. So we got our heads together and we're like, how do we make this automated? How do we facilitate nurses to be able to be the guide? We all know what we need to know. And there's always going to be people that want to do the traditional instructor-directed, instructor-paced, or that second learner-directed. There's always going to be people who want to do that. But for the geeks like us who are constantly learning, and we know what we want, where and what areas we want to grow and advance our skills as a professional nurse, we should be able to do that. And it shouldn't be this long, hard thing, because we already know what we know. We just need to tell our boards of nursing that we know what we know. And so we're facilitating that process and making it more automated, that you just tell us your gap of knowledge. And we use a bit of AI so you can identify
Yeah,
more
that's the
sources
next
and then
question.
hopefully
Yeah.
go deeper down the rabbit hole if you want. So I'll
So
shut up now.
that's
That
how.
was a lot.
No. It's so good. It's so rich, and I think that's so important for people in our audience to know like how it came about, and your background is nursing, right, Karen? You're a nurse,
Yeah.
Yeah.
entrepreneur, and leader, and I
Yeah.
think that you had that pain point, right, and that's where your innovations kicked into play, right, and in creation of RNegade, and then also now IndependenCE. It took a 6-hour trip to see my grandbaby. I do it every month, and my grandchildren. And we listen to podcasts the whole way, my husband and I, on the
Yeah.
on the car. So we're doing that independent learning all the time, and as nurses. So just tell us really, how does this independent CE differ from traditional continuing educational programming?
Well, first, I'd like to say it wouldn't do anything if it weren't for Wendy, because I often say if it weren't for people like Wendy, I'd be strung out in
Yeah,
the gutter, muttering
special.
great ideas at passersby, but nothing would ever get done. So, like Wendy's
Uh,
like, this, why is this
totally.
not done? I'm like, I don't know. She's like, well, come on, let's do
Yeah.
it.
Yeah.
So, how does
Oh,
it differ?
that's wonderful.
Was that the
Yeah.
original question? I just wanted to acknowledge Wendy because she's
Yeah,
sitting
yeah,
she's
yeah.
sitting here
So
too, and
how
none
does
of
it
this would
differ
get
from
done without her.
traditional continuing education programs?
You're
From,
already
how
you've
does independent
already
CE differ from the traditional?
So I'm sorry, Kim, if there's a little bit of a delay, so I will learn to keep my wait
Yeah,
5 seconds
that's
before I
okay.
open my mouth. Um, it differs because I think the greatest way it differs is because you've probably already done the education. You've already done it. You don't have to like you said, going to see your was it your grandberry baby? Did you say grandbaby?
Yeah, two.
Okay,
Yes,
you
two.
are
We have
doing
two.
very well, my friend.
Yeah.
That's
Oh, thank
wonderful.
you, gracious. Look at you.
It
It's a
differs
joy.
because it is how we are. It's what you're naturally interested with, how you're naturally inclined to learn, and it allows you to get credit for something you've already done. If I've read a textbook, or if I could pick one of these books off my shelf, read it, enjoy it, learn from it, it improves my life, it improves the lives of my clients and my patients and those around me. And it's almost like I think the biggest difference is waking up to the fact that you've already done the learning, because those
Hmm.
30 continuing
Wow.
education credits you need, it comes up, and you don't, because the learning you've been doing the whole
Mm.
2 years up until then, by podcasts, by audiobooks, by reading, by researching,
Mhm.
research articles. Have you ever gone down a rabbit hole and spent hours on NIH and just gone, oh, what's that? Oh, what's that? That counts
Yeah.
with this. Your
Yeah.
rabbit holes, your
Yeah.
natural inclinations of what to learn and how the medium is
I love
with which you learn it. It's how you get
mhm.
credit for the learning that you're naturally inclined to already do. I think the biggest barrier to entry in this kind of learning is the freedom, because and the recognizing that what you've already done, but because it wasn't in this
Mhm.
stack of approved continuing education by some instructor at some
Yeah.
instructor's pace, that was done. This is you. This
Mhm.
is like
Mm.
homeschooling for nursing. This is unschooling. I don't know if you know that term, but it's very free, because now
Yeah.
the whole reason you're
Mhm.
interested in the material is because you have a gap in knowledge. If you were an expert, if you had expertise in something, you don't have a natural inclination to you. It's boring. You already know
Sure.
that.
Yeah.
So actually you
Yeah.
identify your gap in knowledge by going, oh, why was that interesting to me? Oh, because I didn't know any of that. It was fascinating to me. So this technology will just bring you through what was the gap in knowledge that you identified, what was the material, what was the content that filled that gap in knowledge, how is your practice going to change moving forward. Can you give some examples of where you would apply this new knowledge to your practice and how it might improve the lives, the patient outcomes, the health of your patients? And it
Yeah.
is just the process of it is outlined by the ANCC.
Yeah.
And
So,
yeah.
can you talk a little bit more about like the process? Maybe Wendy, you want to chime in here? How does like walk us through? How does this process
Yeah.
us look if they're, a nurse is using this, how can they using IndependenCE?
So if a nurse, so we'll use even the RNegade podcast as the example. When a nurse is listening to one of our podcasts, at the end of it, now they're going to go into the Independence technology and they'll identify what they were listening to. So whichever podcast they were, they give it that title and how long it was, right? Because that's then going to track the number of CEs you're going to get for that interaction with the tech. So if it was a 60-minute podcast, you're going to identify the title of it, the length, and then you're going to identify your gap in knowledge from what you learned in the podcast. And that's the other thing we love about this is that's different for everybody. So you now are empowered to say with your continuing education credit, I learned this, like I had my aha moments because I learned this from the podcast. And then from there, you're building out your objectives, your outcomes, and how you see that transforming your scope of practice. So it becomes very personalized. And that's one of the things that we really love about it is the freedom in that. That's amazing. And everybody's learning something from whatever they're doing in their continuing education, whether they're on a webinar or at a conference or listening to a podcast. Everybody's gaps in knowledge are different. So now you get to identify. Yeah.
So it makes me want to just like peel that back a little bit more because I know everybody can understand that because they understand that I have different gaps in knowledge than my colleague Tanya or whoever I'm working with, right? And we both mentioned about these unique gaps in knowledge. So how does IndependenCE honor those differences?
Because you're the one who gets to pick what you're actually going to earn your CE credit from the activity that you did. So you've listened to an activity. If we use the podcast, you've said, I'm going to generate a continuing education credit from this podcast that I listened to, but then you become the one in control of what you're getting credit for with the CE, because you identify your gap in knowledge. Then the tech will help you identify objectives. And you're like, oh yeah, that's what I want to highlight for myself. And what were the outcomes from that? Oh, yes, those were my outcomes. And then you engage in how is it going to transform my practice going forward? So the AI is helping you, but it's not controlling it. And so you're leading yourself down the path.
Yeah. Here's an example of that. Like we have a podcast on the someone say that for me, endocannabinoid system.
Yeah.
Yes.
Well, the endocannabinoid system does a lot, right? So in that podcast, we talk about how the receptors are affected, how pain is influenced, how inflammation is influenced, how mental clarity, is influenced, and how there's certain people like the pitfalls. Some people, it's, in a rare occasion, it's not good for people. So it was a very robust podcast about the that system. And one nurse maybe her state requires her to do a CE about pain, chronic pain. Another, it might be about PTSD. Well, the the E system affects both trauma, right? Both affects PTSD and pain. So two nurses in two different states have two separate gaps in knowledge mandated by their state board. But that same podcast, because then the AI will kind of lead you down, okay, this is what you got from the podcast. This is what you learned. These were your objectives. Your outcomes were different than that nurse's outcomes. And if there needs to be more resources for, more time to fill in that gap, the technology will give you some sources to go down a rabbit hole a little bit further with, to specify your learning, your identified gap in knowledge more for you.
That is so cool. So what types of learning activities can the nurses actually use to earn their credits? I'm guessing it's more than just like watching.
Where do you learn? Yeah, where do you learn? It could be a traditional. Yeah,
the minimum.
everywhere.
The minimum activity just has to be, right, a CE
Mhm.
equals 50 minutes of an activity. So as long as they were
Mm.
engaged in something that's longer than 50 minutes, right, and
Mm.
they're identifying that, it's wherever they were learning. Think of at a conference or even
Mm.
your camping trip coming up, right?
Yeah, glamping retreat, yeah.
Right? So let's
Yeah.
just say they were engaged in a lecture or a webinar or an activity that was an hour long. Everybody's going to have a different experience like
Mhm.
that. That's what we were talking about. So as long as the activity was
Mhm.
more than 50 minutes, even if it's up to 3 hours, 4 hours, but they get specific about what they actually learned and how it's going to improve their
Okay.
practice. That's the difference. Right now, most people are used to going to a conference, they sit at a lecture, and it rewards them 1 CE. Well, with an
Right, right.
independent membership, you might be able to turn
Mhm.
that lecture that you were at into more CEs because there were other gaps in knowledge that that lecture filled for you, right?
Mm. Mm.
You're not going to be limited. You're actually unlimited by an activity.
That's really neat. Wow, wow. That's a huge opportunity. I mean, to earn your CE hours with just one activity,
Yeah,
right?
I mean, if
If
you
you have a natural spirit of inquiry that keeps you like searching and going down that path, it could open
Mhm,
up other avenues, right, for you to learn.
mhm. And that's actually what we're hoping,
Yeah.
Kimberly, because
Mhm.
continuing education is supposed to be for anybody who's
Mhm.
engaging in it, but we're talking about nurses. You're supposed to be growing
Sure.
in your knowledge base. And we've
Mhm.
dumbed it
Mhm.
down so much, and people have gotten so disinterested in doing it that the stats show today that healthcare used to be 10 years behind is now 15 years behind what's actually going on in
Mhm.
the system. That's
Yes.
scary. We're regressing. And I think
Yes.
the way we do continuing
Yeah.
education is a part of that. It's a part of the reason. There's probably multiple reasons, but for us,
Mhm.
I'm like, well, if
Powerful,
people can
powerful.
just,
So wow, I could do it. We could do a whole 1-hour webinar on just that. But
yes.
for today's purpose, I just want to kind of talk a little bit about our role at Power Up Nursing is really to help improve the competence and confidence of nursing and
Mhm,
nurses and advancing the science and spirit of nursing practice.
mhm.
So how does this kind of learner-directed, learner-paced continuing education that you just talked about, how does this improve that competence, that confidence in nursing practice?
It really just highlights what I mean. If you go back to that Joe Rogan, James Nestor podcast that I was talking about, like what Wendy was
Yeah.
just saying, it's showing you what you actually know. And actually that the knowledge, if you are a person that pathologically curious, of the pathologically curious ilk like I am, and you're constantly, it's not going to be for every nurse. Some people just like the take me by the hand, give me the pile to pick through, and I'll just check the boxes, my life is busy. But it
Mm,
it kind of
mm,
highlights
mm.
not only that you are on the cutting edge, because the palate
Okay.
expansion, the James Nestor thing, that's not going to trickle down into many parts of the medical system for, as Wendy said, could be 10 years. We're on the cutting edge,
Yes.
and as long as those things are adequately sourced, and often what's the people who are on the podcast are the researchers. They're talking about the research that they've either published or that they've curated, to talk about their particular ailment or their particular expertise. So you are on the
Mm,
cutting edge, and this just allows you to I hate to put it so simply, to get credit, to acknowledge what you're already doing, that you are of the
yes.
pathologically curious ilk, and you deserve to get credit for that. And you are actually going
Mm,
to affect massive change in the healthcare system, because you're going to start, you are a force of getting I always say that nurses are the white blood cells. We have the biggest surface area of the medical system from a personnel perspective. We are the biggest. We're the biggest part of the immune system of the
we
healthcare
are.
system. And as long as we are inoculated with new knowledge, and we go in and
Mm,
we are getting credit for what we're learning, we are inoculated with that
yes, yes.
knowledge, and we are going into the medical system and we are going, hey, I just read here's the source, here's the research. Actually, as a private patient advocate, that's what I did
Yes.
in that lifetime of my
Mhm.
career, where I would research what was going on with this particular diagnosis or this particular medication. What are they doing all over the world that we don't have knowledge? We are wonderful. The US healthcare system is great for a lot of things, but as far as prevention and chronic illness, there's stuff being done all over the world that we haven't even heard of.
Yeah.
The stuff that they're doing in Russia with peptide science and all that, and I have never heard a doctor talk about methylene blue. I mean, and what it does for your mitochondria. But now
Sure.
I can take my published research with my client into their doctor. I not as an adversary, but as a team member, because that doctor has 7 minutes to spend with that patient,
Sure.
and
Right. Reality.
they're say again.
I said that's the reality of U.S. healthcare. Yeah.
Yeah. So it's going to take nurses to inoculate themselves with cutting edge information, new knowledge, new research, go into the healthcare system, their places of work, either the private practices or their clinical area of expertise or whatever.
Mhm.
And you have continuing education that is well sourced, well researched, and it's true. This doesn't work unless you have two sources. One of the components in the independence technology is identifying two sources, two published research papers that are 6 years or younger, 6 years old or younger, or more recent than that. So it has to be published research, and it has to be backed up by science, but you are learning new knowledge that you're not going to be learning when you listen to podcasts, when you listen to YouTube. There's so much available out there, Kimberly. And like I said, even the case study reviews with colleagues, the curbside consults, the Mimosa Mondays, those should count too.
I love that.
As long
I
as they're
love that.
sourced.
Two things you and Wendy both touched on that I just want to shine a spotlight on, Karen. Really, it's that you said that the nurses are busy, right? We're in healthcare, we are busy, and we engage in real world learning moments, like at those Mimosa Mondays, or at the lunch and learns, or whatever we might be engaging in, right? But I love the fact that, how does focusing on these real world learning moments change the way that nurses then apply that knowledge? Because,
Yes.
it's one thing to take in the knowledge, but again, we have to apply. We're talking about gaps. We have the research. The research is out there. What we need to do is close this gap in the translation of the research into practice. So I'm interested in focusing, GMP prepared nurse here. So that translation of evidence into research. So how does focusing on these real world learning moments change the way that nurses can apply this new knowledge and research once they're back on the floor in their clinics, in their leadership roles, or their community?
Again, they're probably already doing it, and now they have a means to show that and to illustrate that. For example, one of our podcast partners is Sarah Lorenzini. She has a Rapid Response RN podcast. She's had nurses say one of the ones was on diabetic ketoacidosis, and a nurse called in and said, after that podcast saved my patient's life, because I learned what I learned from that podcast. That same week, I had a patient with diabetic DKA, and I recognized it because of that podcast. She's already doing it. But with this independence process, you're saying, what did you learn? What was your gap in knowledge? How is that gap filled? How will you take this into your practice moving forward? Well, she would just say, well, I already did. But now it facilitated the recognition of DKA in my clinical setting.
Well, and imagine too, I was going to say, imagine when a healthcare system brings independence membership into their system, and we can actually see themes of what nurses are actually doing their continuing education and learning on. And then that institution could see that. When you say, how do we affect change? When they realize what their teams are learning and they see themes in it, and then they choose as an organization to bring that in at a deeper level, that's how we see even bigger change.
Wow.
We're
And
talking
that
about
data, I'm sure, is going to be Powerful,
Yeah.
Wendy. Thank you
And
for adding that
eventually we'll
because
be able
I
to,
can see. Mhm.
I
I
was
can
going to
see
say,
that
eventually
data.
we'll be able to
Your
report on that.
platform collect. Yeah, I'm sorry. There's a bit of a delay here. I apologize.
Yeah.
Does the platform allow for data to be retrieved by the
It will.
organization?
It will, because we
Perfect.
recognize
That's awesome.
right now we have it for the individual level, but we
Mhm.
anticipate going down the path of this with healthcare institutions. And so we will be able to report that data so that they'll be able to
That's
see
wonderful.
what their teams are learning, where their interests
I think
lie,
that's
where their gaps in knowledge are. Imagine a healthcare institution learning that, right? It might be intimidating for a
right.
nurse or nurses to admit that when they're on the
Yeah.
job, but if an institution could see that on a theme basis and say, wow,
Mm,
okay, all right, we've got an issue here internally with this, but this is how they're learning and
mm,
changing their practice.
sure.
Like it
Wow.
has so much limitless possibility.
Yeah,
Yeah.
and it's just
And
like
you really can.
when when you're building a house and it's 3 more months and it's 3 more months, like the house structure is like the beta, and once you get in there, like, oh, let's do this color, let's do this tile, whatever. It's in beta, like where it's got to be tested, it's got to whatever. But then once we get in there and start and more people start using it, the themes,
Yes.
the data we can collect, all that will become
Mhm,
more and more
mhm.
apparent. So we're really excited for it, for what it is now. The idea that was, to me, divinely inspired. I mean, I'm not
Hmm.
I'm not saying
Yeah.
the hand of God did it, but it was like it was the artistry of common sense. It's like,
Mm,
you wait a minute, I'm doing my 30 continuing education credit hours every 2 weeks, and I'm not getting credit for them. If we just
yeah.
solve that part, if
Yeah.
we just solve that part, I could die happy. I mean, that would be a big
For
win for
sure.
me. But
Yes.
with
And when we're
AI,
looking at the future of nursing education,
We
I'm
missed
sorry.
that.
I'm going to
We
be
got
yes,
quiet
stuck.
because I
and you're
want to hear
breaking
what
up
you
a
have to
little
say.
bit
There's
there.
a delay. I'm sorry.
Yeah, no, 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 that's okay. I think, you said with AI, and then there was a little bit of a delay and it kind of froze you a little bit. But, looking ahead, this is only going to increase. This cutting, edge technology is going to change how we educate people, right?
Yeah.
Over the next 5 to 10 years. And I think that this is going to continue to evolve and evolve rapidly as it gains more information, as Karen, you started to talk a little bit more about. But before we jump into you telling us quickly about where we can learn more, our audience can learn more about independent CE. How can approaches like independent CE support that lifelong learning of a nurse, not just to meet a CE requirement, but to truly grow in their profession?
Yeah.
Can you ask the
So
question
probably in
again?
their everyday life, right? I'm assuming. I guess I was
Yeah.
just saying, like, how can approaches like independent CE support that lifelong learning with nurses that they're already
Well,
doing, like you said, Karen? They're already doing.
reverses what our institutional educational system has done to us. It is the opposite of telling a 7-year-old kid to sit still in a desk and not go outside and play, where their learning for that age actually
Yes.
occurs outside, touching things,
Mm,
feeling things, running, breathing, looking at nature,
mm,
asking questions. Instead, for 12 years
yes.
of primary school, you're told to sit still in a desk and learn what somebody else
Yes.
thinks is a great idea. And you're bored and you're
Yes.
not ready for it. And then
Yes.
you have to relearn it
Mhm.
when you are ready for it. This says,
Yes.
kid, you know what, now you're an adult. Okay, and then we graduate from high school and it's like, okay, now what do you want to learn? I have no idea how to know what I want because you kind of taught it out of me for 12 years in a row.
I
This
love
gives
that. I love
you,
that. Yes.
we are snowflakes. What's that Buddhist saying? It's like the likelihood of you existing is as likely as a life preserver being thrown out somewhere in all of the world's oceans and a sea turtle popping its head up in the middle. That is how likely you are to exist. Very unlikely.
Yes.
So it can
Mhm.
only be that the manual for what we need to know, what our gaps in knowledge is, how are we supposed to grow, is built into our snowflake of a system.
Mm,
And yet we're all like put in lines, in desks, told to sit down and shut up and learn how to subtract. I mean, this gives you the
Yes.
power back. It really is. I think it's going to be, for a lot of people, it's going to be too much freedom, and that's
Yeah.
okay. But for people like me who are just like, like I can't get enough, it like I said, I will be happy if it just gives those kinds of people, those kinds of nurses, credit for their pathological
Mm.
curiosity and their
Yeah.
willingness to bring it into the clinical setting or with their patients and into their own lives and get rewarded for it.
Mm.
Yeah.
Wow. We could talk so much more about this, and I have to be mindful of time. But with that being said, I just want to point out one thing that really struck me as you were talking, both of you. When we think about autonomy and personalization, we know that these can play an important role in improving retention and engagement, right,
Mhm.
of nurses. So, and this is something we know that we're in need of. Also, I think about evidence-based practice, translation of evidence-based practice, that is. Um, and the very first step of that is embracing that spirit of inquiry, or
Yes.
curiosity. And this
Yes.
is that impetus that I think that can be really utilized to help nurses and organizations get to where we need to be able to meet the needs of our changing needs of our community, continually evolving during these unprecedented times. So I just want to say thank you to you both. I mean, in closing, before we wrap it up, just please tell our audience how they can learn more about IndependenCE or how they can contact you.
So IndependenCE, that membership is on our website right now. So the website is RNegade.pro. And you can go to the Independence membership and take advantage of some promo pricing because we're not live yet. The membership goes live in September, and I would love to give you an exact date, but with technology, you're always playing with some things that
It's
we
like
might
building a house.
tweak, tweak along the way, but it's coming in September. And we have promo pricing right now until then. And then when it does launch, we will have lots of information for people on how to use it and,
Wonderful.
such as that. But you can reach us at hello@rnegade.pro. That's our email. And again,
RNegade.pro.
yeah, there you go.
There we go. Okay, perfect. Awesome. Thank you both so much. Karen and Wendy, thank you for sharing your vision, for continuing to push the boundaries, right, of what's truly possible
Mhm.
in nursing and in nursing education.
Yeah.
Independence CE really, it really feels more than just a platform. I think we're in the midst of major change here in education and in healthcare, allowing nurses to have that control over their learning and then honoring where they're coming from as they gain real world knowledge and experience.
Yeah.
So I want to thank you for your time and all
Wow.
that you shared with us about this. And to our audience, if you're ready to take your continuing education into your own hands and experience this new way of learning, I encourage you to explore IndependenCE. Reach out to Wendy, reach out to Karen, and contact them at the website there. This has been truly some independence today as we look at the future of continuing nursing education with Power Up Nursing. And until next
Thanks,
time,
Kim.
Yeah.
You're
Thank
always a
yeah, my
delight.
pleasure. Wow, likewise, you are always so funny too, and I just love that about you. Um, keeping it real, right? I love that. So, in
Yeah.
closing, thank you again for joining us. And again, remember, nurses, you are empowered to learn in your own way, and when you do that, everyone will benefit. So,
Mhm.
continue to be brave, be well, and be you. Have a wonderful
Mm.
day, everyone.